record this. So like I said, I'm not able to see everyone, so feel free to write something in the chat or just yell out your answer, your questions so that we can hear. And I know some of you have, like Jaron said, he dissected a frog before. Has anyone else ever dissected anything? Izzy dissected like a horse heart, which is kind of cool. No? All right, so you guys can tell me, like if you, there's not a lot of people here, so feel free to just say, can you look at this or can you look at that? And first, the way that you can tell whether your pig is male or female is there's usually, if it's a male, there's like an opening right here, and this is where they this is where they pee, or they have also their penis is here for a male. For a female, she has an opening back here. This is her anus, but she also has this opening, which is where she pees, and also where if she's impregnated, that's where the sperm are going to go. So for this one, I don't see any opening here. So this one is not a male, it's a female. And this is our umbilical cord. So let's go ahead and just cut the umbilical cord real quick and see if we can see the blood vessels. Okay, so they actually injected this pig with like a plastic, a dyed plastic. So you can see the blood vessels. So the arteries are dyed pink and then the veins are dyed blue. So you could see like 2 arteries and 1 vein. And this is where the baby got nutrients and oxygen from the mom, and also got rid of waste back to the mom. So feel free to just throw out questions as I'm showing you this. Here's the pig, and usually what we do is we look at we look down the throat first before we cut to see the different openings. And their skin and their bones are actually really soft right now because they're not completely. This is where it was injected with the dye so that its blood vessels would be. Uh-oh. Okay. So here's we're going to be able to see in her, okay, down her throat. So you guys have in your mouth, you actually have 2 openings. One goes down to, can somebody tell me why do you have 2 openings that go down your throat? One goes where and one goes where?
Isn't one that takes in the fluids and the other takes the food?
Absolutely. Well, one takes the fluid and the food. And what's the other tube for? Yes, Ellie? Go ahead, Ellie. You can unmute yourself, Ellie. I can't hear you.
It's so that you can breathe.
Yes. So one tube is gonna allow you to take air down, and one tube is going to allow you to take food and water. So you don't want that to go down the same tube, and that's what happens when you like choke or try and laugh and eat at the same time. So you have this tube right here, this little hole. Oops. Okay. This little hole right here. Oh, okay. This one is going to go down to your lungs. So this is your trachea. It's going to go down to your trachea, which is your windpipe. And then right behind it is another tube, which is going to carry your food, and that's your esophagus. So when you swallow, then there's a little tab that covers up your esophagus. I mean, it covers up your trachea so that no food or liquid goes down your windpipe. And that's why you don't want to jump around and laugh and talk while you're eating, because there's some problems that can happen. If obviously you could choke. So those are 2 openings. The rest of this is just showing, you've got, your hard palate, soft palate, you've got the tongue. They've got little teeth coming out on the sides. Okay. So now we're going to go ahead and cut open here so we can see where that goes down. Okay, so maybe if you want to zoom out a little bit. Let's look at any questions so far? I find scissors to be much easier than the scalpel because the scissors won't cut down into the cavity. Okay, cutting open one. Anyone want to take a guess what this big organ is right here?
The stomach?
Close. The stomach is above it. And actually, this is going to be the biggest organ in your body that's inside your body. Your biggest organ is actually your skin, but this is your biggest organ in your body. And normally it's like a kidney red color, like a maroon color.
Is it the large intestine?
No, but we will be seeing the large intestine. There's some of the intestines right there. Starts with an L.
Lungs?
No, but you're getting close.
Liver.
Liver. So the liver is this gigantic organ right here, this big thing right here, okay? And it's got several lobes, and that's our liver. Our liver is pretty big too. I'm going to cut this here, but you can see that the umbilical cord on the outside, remember, it was carrying blood and nutrients from the mom. And then on this side, you can see that the blood vessels are continuing to go into this baby, into its liver and intestines. So I'm going to cut that. And then let's go ahead and cut this open a little more. He's kind of skinny, so it's hard to see him. If you get a pig that's closer to being born, then you can see more. I don't know why I'm calling it a he, because it's a she. Okay. Oh, you want to pin her down? Pin her down. It's my assistant. Okay, so we've got these organs. I'm going to go ahead and cut up now. You can see some of the intestines, and we're going to go ahead and show the path of food through it after we cut up here a little bit more. Okay, so one thing you'll notice is that this is kind of like the abdominal cavity, and it's completely walled off. Like if you look, it's almost like there's like a ceiling on top where you can't go through to the upper chest cavity. And this muscle right here is what helps you breathe. Anyone want to take a guess what that is?
Lungs?
Lungs are going to be right above it, but it's a muscle. And if you're a singer, they always tell you to kind of like breathe with this muscle. It starts with the D.
Diaphragm?
Diaphragm. Awesome. And So this diaphragm is a muscle that actually pulls up and down, and it's what causes air to come into your lungs. If you don't have your if your diaphragm is not working, then you can't pull air into your lungs, and it kind of keeps like a certain air pressure in your lungs. So if you look, here are the lungs right here, and this is your heart, but your lungs are kind of like in this sealed off space. So if somebody like stabs this poor little pig and breaks that seal, then their lungs will collapse. Or if you get shot right through here or some sort of injury, then suddenly your lungs collapse and you don't have that ability to take in air. So here's I cut through some harder structures, and that's going to be the rib cage, which at this point is pretty soft. Okay, so here's the ribs, and I'm going to cut the diaphragm open a little bit. Okay, and then I'm going to cut up a little bit so you can see where the air is going to come down and where your vocal cords are and all that. So if you feel your own neck, you'll feel like a little bump on your throat. And that is where your vocal cords are. So as you talk, you can sort of, guys have like a bigger one, like they call it their Adam's apple. I can actually feel a bump, but that's where your voice box is. And so the air is going to come, remember that little hole, the air is going to come down into your voice box, and it's going to go down your trachea, and it's going to go down into your lungs. So the air coming in and out of your vocal cords is what gives you sound. Okay, and then remember there was another hole behind this one. There's another hole behind there, and what does that carry? It doesn't carry air. What does it carry?
Food and liquids.
Food and liquids. So that is anyone know what that tube is called that carries food and liquids? Starts with the E.
Is it the esophagus?
It's the esophagus. So your trachea, these are some glands that are on these little like weird kidney bean things. These are some glands that are on your trachea. But this white tube right here is your trachea, carries air. So if you like touch your own throat, it's kind of hard. It's because your trachea is like a straw, because you don't want it to be squishy, because if air comes through and it's squishy, then the air is going to like not be able to go through. But if it's like a hard straw, then the air can always go in and out no matter what. Even if you're lying down, even if someone kind of like pushes on your throat, you still have it open for air. But your tube behind it, which is going to carry food, is called your esophagus, and that is a squishy tube. Did you have a question, Ellie?
No, I didn't.
Okay. So here I'm separating the two tubes. You actually have this squishy tube. This is your esophagus, and it's carrying food. And then this is your hard tube, and this is your trachea, and that's carrying air. And that tube is going to lead to your lungs, which are actually not really balloon-like, which you would think. They're more like, it's more like a sponge. So if I cut a piece of this lung and look at it under the microscope, it actually would be like, it would look like a sponge, tiny, tiny millions of holes. And those little holes are like tiny air sacs that will fill up with air. So it allows you to have lots of, instead of one balloon, like millions of balloons. And then this esophagus is going to go down and lead to our stomach. So someone mentioned stomach before. Let's go ahead and see if we can follow it through. And we'll look at the heart in a second too. Okay, so we've got our stomach tube. You can see it continuing down. So let's get rid of one of these. Oh. So here's our trachea. And I was trying to pull off a lung, but the trachea is attached to this lung, so I'm sorry. Here is this esophagus coming down, and it should get to what somebody guessed earlier. So I'm going to take this liver out of the way. This is a gigantic organ, and this is actually the organ that you could donate some of it to, and it will grow back. So it's kind of cool. It's like it will regenerate. So here's a liver. It's full of this plastic dye because there's a lot of blood that goes into the liver. Okay, so there's your liver. And then this pouch is where this your esophagus is leading to the stomach. So here's the stomach. And why is it empty in this pig? Why is there nothing in here?
Because it hasn't eaten anything yet.
Right. Where is it getting its nutrition?
From its mom?
From its mom, from its umbilical cord. So if I cut this open, if I cut up the stomach and look inside, okay. So there's just some kind of fluid because the baby is actually, it's still swallowing fluid because, the baby's kind of floating around in this fluid sac, this amniotic sac, just like you were when you were a baby, and you're swallowing the liquid. So any of that liquid that you're floating around with is actually going down into your esophagus and down into your stomach. And it's not food, but it's sort of just kind of gross stuff that you're swimming around in. But you're not getting any nutrients from that. Okay, so from the stomach, where does your food go from your stomach? To which intestine does it go first? Small or large? Anyone? Yep, Ellie?
Is it the small intestine?
Yes, it goes into the small intestine. So these look like ramen noodles, but they are not. And so this is where your food goes from your stomach, slowly empties into your small intestine little by little. And it takes about 4 hours to empty our stomach. So that's why after you eat a meal in about 4 hours, you feel hungry again. But it's going to go into your small intestine, and that's where the blood is going to pick up nutrients. So the food that's been in your body so far, it doesn't really get into your body, like into your blood, until the small intestines. So if you cut out somebody's small intestines, they would starve to death, even if they ate all the food and all the food went in their stomach and all the food went in their small intestine. It's only in the small intestines where they actually get the nutrients. It goes to their blood and the blood carries it to the rest of the body. Okay. And then it goes into your large intestine, which if you look here, it's a little thicker. Our small intestine is kind of in the middle and our large intestine goes around, but this pig has 2 sections. And then it's going to go, here's the end of the large intestine. And the large intestine actually just absorbs water. And that's why your poop, when it comes out, is hopefully not watery. You want your poop to be semi-solid, not watery, because you want to keep all the water in your body. So it'll soak up the water in your large intestine. And then by the time you poop it out, it should be not watery. So here's where it's coming out. It holds it in the rectum, and then it's going to come out through the anus. And a couple cool organs right here that we can see. Anyone know what these are in the back? There's a bean that's kind of named after it because it's sort of the same shape.
Kidney bean, or
Kidney
it's a
bean.
kidney.
Yes. So here, these are kidneys. And they're not in the front of your body. So if you remember, this is all covering. So they're actually in the back. And for us too, we have kidneys in the back and they filter our blood. So anyone who's been in my Control Your Cell class, you learned about how the kidneys will filter your blood. And then they will take that waste to your bladder and then you will pee it out. So here is the bladder, this bag right here. And then she will pee it out. Actually, for pigs, she's going to pee it out here. But if you look at these tiny little things right here, anyone want to take a guess what this is? What are these? These are unique to this pig. These tiny little beans. Because she's a girl. What
Are
is she?
those the ovaries?
Yeah, these are the ovaries right here. And then instead of like one kind of sac of a uterus, this pig has kind of a long tube on each side for a uterus because pigs can have lots of babies. So they can, this is going to fill up with lots of baby pigs. Unfortunately, she's not going to have any babies, but if she were to grow up, these are where the pigs would develop in the uterine horn. All right. Any questions about Miss Piggy? Anything else you want to see? We usually do the brain and the eye. So if you guys want to take a look at her eye, is going to be really small because it's a little bit underdeveloped. But we can look at the cow.
Is there any bones in the pig yet?
I mean, I think, I'm not sure at what stage, like you could see these are ribs. And there are bones, but I'm not sure. They're really soft. That was gross, huh? Okay, like this is her bone, but it's, I just cut off her leg. So this is bone, but it's just, I think it's still really soft. So we're able to even see her. Let's take a look at her skull a little bit. We'll do the eye of the cow. So this is probably the hardest part, is trying to extract the brain, because brain is really, really mushy. I'm going to get the skin off first a little bit. And so I have some, students in my class who would just they would just be so meticulous, and they'd like be able to get a beautifully extracted brain without damaging it. But it takes a lot of patience, and I personally cannot do it. But right now I'm just peeling the skin off the skull, and the skull is going to be really thin and soft again. And for baby humans, we have like little cracks in our skull, so that when you're coming out of your mom's pelvis, the skull can kind of like squish a little bit. So there's like little spaces, and then they all kind of fill in and harden as you get older. All right, so this is the skull. It's not very hard. It's not making like any kind of thick sound. Okay, so I'm going to go ahead and cut through the skull real gently, because the brain is super soft and fragile, which is why you have a skull, because you don't want to damage your brain, and which is why you always need to wear a helmet if you're in danger of hitting your head. So bikes and skateboarding, motorcycles, and that kind of stuff. Oh, I feel like I'm going to ruin his brain. Her brain. Okay, so I'm going to cut through the skull a little bit. And if you've ever had brain, some people eat it. It looks like scrambled eggs because it's so soft. I think I'm going to ruin it. Okay, so you can see how I already damaged it by just trying to cut it a little bit. Look at how soft it is when I touch it. It's almost like pudding or flan. And I don't know how some of my learners have been able to remove the skull without damaging the brain. But you can see kind of like the little swirls and then the blood vessels in the brain. But again, when I touch it, it's like even if I just push my finger on it, that's how fragile our brain is. That's pretty cool. All right. Shall we look at the eye real quick? Anything else you guys want to see on the pig?
Did you get out the skull, or was the skull not there?
Oh, I peeled off the skull. So here's part of the skull that I removed. I got the skin off and then I cut off some of the skull. Okay. I guess I'll show you one more thing. So since we're doing the brain, the spinal cord. So the brain is connected to your spinal cord, and that spinal cord is what carries nerves to all the rest of your body and allows you to move and feel and send messages back and forth. So if something's wrong or damaged on your spinal cord, then the messages don't go up and down and you can become paralyzed from wherever that damage happens. So so your spinal cord actually needs to be protected by your spine. And I don't know if you've seen movies or know people who've had injuries in their spinal cord, but it's very devastating. There was a guy in my college, he was like a freshman in college, and he played touch football, flag football, and just a freak accident. He landed on his head and broke his back, and it damaged his spinal cord. So he was paralyzed from the neck down. Okay, so I just wanted to show you the spine and the spinal cord. This is like, this poor piggy is getting thrashed. Okay, cool. So if you feel your backbone, it's very you'll feel like a very hard spine. This all around this is all bone right here. This is part of your back vertebrae. And this is your spinal cord. And it's very soft. It's a bundle of nerves that travel. So your spine or your back is what protects your spinal cord from getting damaged. And there's your spine has like little bones stacked upon each other, but sometimes like people throw their back out, or they get what's called a herniated disc, and that impacts your nerves, and then you get back pain and all kinds of stuff going down your leg or your butt or wherever. All right, now we are really done with pig. So let's take a look at our eyes. So your eye is normally more clear here. This is cloudy because of the chemical that this eyeball was sitting in, like a preservative. And sometimes there's little eyelashes on here, but I don't see any. And then this part right here, this dark colored stuff is actually muscle. So muscle is actually meat, or when you eat meat, you're eating muscle. But there's muscles that control your eyes. So we have lots of pairs of muscles around our eyes, so we can kind of just move our eyes without moving our head. And then I'm going to go ahead and this front part is called the cornea. Let me get my knife. Okay. And I'm going to go ahead and cut it to separate the front half from the back half. It's just squirted. Gross. Okay, so there's a jelly-like fluid that's filling the inside of our eye. You see it squirting out here. And I'm going to use my scissors. To cut it. So anyone know, if you look at your eye, anyone know what that hole in the middle is, or that dark, there's like a black hole in your eye.
The pupil?
Very good, it's the pupil. So your pupil is actually a hole. It's not a black thing, but it's a hole. So if we look at this eyeball, here is the inside of the front. And do you see that hole right there? That is actually, when you look in someone's eye, it looks like a black dot, but that's actually a hole. And so if I cut off this cornea, and I guess that's I was thinking about this last night, like when people die and they say, do you want to donate different organs? One of the things they do like to collect is a cornea. So I guess these are kind of things that they can transplant onto someone else. So here's a cornea. And as people get like damage or they get older, they can get like cataracts, and that's where their cornea gets cloudy. So that's why you don't want to look at the sun, because it can damage your cornea. Okay. What about this? Okay, so I'm removing the cornea. What about, and you could actually like scratch your cornea, like if something flies in your eye, or if you rub your eye, when you get sand in your eye and you start rubbing it, you can scratch your cornea. It's pretty thick. What is this part right here? Anyone have an idea? So this hole is the pupil, and then this is like the colored part of your eye. which gives you like a brown color, a blue color, a green color, depending on your eyes. This is your iris. And this is actually a muscle too. It can make the hole smaller. If it's really bright out, this iris will contract and make the hole smaller so that less light comes in. And then when it's dark, and then your pupil will get bigger, the hole will get bigger so that you can let more light into your eye. Okay, and then here's the back. So there's like something called a lens. This is actually this hard thing right here is a lens. And it's surrounded by this jelly fluid. So this lens, I don't know about you, but like some people eat the eyeballs of fish and then they're like chewing on it, and then there's something hard. Okay, well, that hard thing that they're like chewing on is it's this hard lens. And this lens is what adjusts light so that you can focus. So if you need glasses, it's because your lens is not able to focus the light properly. And then here's the back. This this thing that I'm scooping away is the retina. This is the screen of your eye. But see how it's a little sparkly inside? Some animals, they kind of have a sparkly, their eyes glow a little bit. So that's why it's a little bit, it shimmers, so they can actually see better with less light. That's why they're running around the house at night while you're sort of stumbling around and have a hard time seeing. And then all of the information goes from your retina, and I'm trying to move it, but it's like stuck on one part of the back. And this tells me that this is where the optic nerve is. So right here, this nerve is now going to take all these messages that you see to your brain. And that way you can know what you're seeing. So if you have damage to your optic nerve, then you're not able to. That's one reason why some people might be blind. Wow, that's really gross. Okay. Any other questions, you guys? Was that enlightening? All right. Jaren, is that Tana or Tana? What's your, do you mind? Did I mispronounce your name? Or is that not your name? Yes, no? Any other questions, anyone? Anything else you want to see? I have some other specimens, but I haven't really dissected a crayfish before. And honestly, this cricket is super grossing me out. I don't want to cut it open. So yeah. All right. Well, thank you guys for joining me. If you don't have any other questions, hi.
Doing this.
Sure. Yeah. Thanks for joining me. And good to meet you, Sophie. I know you're in my class too.
Yeah. Okay. Bye.
Bye.
Bye. Thank you.
Sister. Bye. Bye, Jaren.
That's gross. All right. Thank you, Ms. Han. That was awesome.
Oh, good. I'm glad. Go have a nice lunch.
Perfect.
Mm.
The eye was weird. It was just like the hard thing moved
Lens?
around. Yeah.
Oh, I know. Normally it's kind of held in place in our own eye, so it doesn't bounce around. But yeah, once I cut it, it was like loose.
Oh,
Yeah,
thank you.
sure.
Bye-bye.
Bye.